there, welcome to the show. I'm Dr. Dan Thomson. Thanks for joining me today on DocTalk. We're going to have a great show. My guest today is Dr. Jim Lillich, and we're going to talk about something that is here and futuristic for medicine. It's regenerative medicine. It's going to be a great show. We're going to learn a lot. Stay tuned.
Closed captioning brought to you by Ag Promo Source. Together we grow. Learn more at agpromosource.com. This segment brought to you by Kansas Regenerative Medicine. Your stem cells, your health, your life.
Dr. Lillich, welcome to the show.
Thank you.
Folks, this is Dr. Jim Lillich. He's an associate professor here in the Department of Anatomy and Physiology at the College of Veterinary Medicine at Kansas State University. He's an incredible equine surgeon, does a lot with equine lameness, world-renowned, and today we're going to talk about something that's really exciting to me, and that's the application of regenerative medicine in horses and
where we take it from there.
Yeah. So kind of give us the rundown. What is regenerative medicine?
Well, it's a broad term, but basically it's trying to use what is within what's within the body in order to accelerate or maximize healing potential. So we know that wound healing is very, very complex and orchestrated by a number of different types of cells in the body. And what we're trying to do is use those cells and what they produce, and we can take them outside the body and grow them in the laboratory and then return them to the body so that the body can accelerate its ability to heal and maximize the healing potential. Rather than use other medications which really aren't necessarily designed for those things or help in some regards, but let's be honest, Mother Nature's a whole lot smarter than we are. So we're just trying to use what she gives us, know a whole lot more about that process to regenerate tissues. And from the human side of things, the biggest problem is regenerating the spinal cord injury because it's a permanent deficit. From animals, it could be the same things that we deal with, whether it's arthritic change in a joint where you're no longer athletically productive or sound if you're a horse. If you've got an infection somewhere that you need to beat, and that could be within any tissue, and it is not toxic to the body if you use these cells and use these products.
So talk to me a little bit about the arthritis and so give me just kind of like a little description of what I'm going to do, what kind of tissue you're going to take and
Sure. So every tissue in the body, virtually every tissue in the body has got some way to replace itself. So we call those generally stem cells, and there's a lot of different terms, mesenchymal cells or mesenchymal stem cells that are generated from fat. They even can come from muscle, but most of the time we're generating these from fat. All right, so we can take a piece of fat from you, and the cells that can reproduce in the laboratory in underneath conditions that grow them could then expand and help direct or become or help tissue that is back in the body heal itself. All right, so we regenerate that tissue by ramping up those little itty bitty cells that are supposed to do the job. We just give more of them.
Okay,
right?
So you're just taking them from one place and putting them where they're needed.
Exactly. And we know a whole lot more about what they require outside and what they require inside. So that there's other, what they're called cytokines. These are signals within the body and proteins within the body that ramp those things up and get them to do their job.
Well, if you can take some fat off me, which Lord knows I know is regenerative, and put it in my knees, I'd be happy.
Exactly,
with
and
that
that hopefully will reduce the inflammation or cause the body to get better. Help maximize it.
All right, we're going to take a break, folks. When we come back, we're going to talk a little bit more about what we do know about regenerative medicine with Dr. Jim Lillich.
This Meet the Future Veterinarian is brought to you by Zuprevo. Choose confidence. Choose Zuprevo for BRD treatment. Julia Simons grew up in Maryland and earned her master's in food systems and ag policy before attending veterinary school at the University of Wisconsin-Madison. Her goal is to provide high-quality veterinary care to livestock while protecting the food supply and the animals' well-being. She would like to work in the Northeast for a dairy or mixed animal practice after graduation.
We do business with Blueville because of the quality of their work. It is excellent quality, and because they make a commitment to their customers.
We enjoy the benefits of hiring a good company to help us maintain this home.
We will always do business with Blueville. We have for many, many years, and there's no reason for us to look for any other service.
DocTalk, brought to you by Santa Fe Trail Meats in Overbrook, or visit us online at sftmeats.com.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with my friend and colleague, Dr. Jim Lillich, who's an equine surgeon, and he's an associate professor here at the College of Veterinary Medicine in the Department of Anatomy and Physiology, and he is doing some outstanding research and really cutting edge things in taking human application to equine application, and there's much more we can do. But when we're talking about regenerative medicine, taking cells from one spot in the body, putting them where we need help and where we normally don't get good regeneration and healing, Dr. Lillich is working on some things. So what are some things we know?
Well, so regenerative medicine's been with us for a while. There are some well-designed studies out there that document an effect, but we don't know exactly the metabolic or the exact mechanism of how that's going on. So Dr. Weiss, who's in my department as well, worked in the small animal clinic with a couple of the surgeons, and they did some fat cells derived in very damaged or hypnosplastic dogs. And the ones that were most severely affected, they seemed to improve. And it was statistically significant. So in the horse realm, we think that we can actually get potentially better tendon healing, things that are better for the joint, because wear and tear. I mean, athletic endeavors, you pay a penalty for that.
Right.
So if we can keep that system going, functioning at a peak, then we can get the most use out of it, and the quality of life can be better. Clearly that's what we're trying to do for people, is make their quality of life a whole lot better. So what we know is we can take cells, we can put them into certain locations, and we can now ramp them up, and we can improve the clinical conditions of an arthritis. We can improve a range of motion, or we can improve a level of comfort. Do we know exactly what's causing that yet? That's difficult to determine. I mean, we're looking at a molecular type thing. It's down below the cellular level to figure out if that is actually what's causing it.
So the signals from these cells, and I've got to get things down to kind of my level, but the fat cells or the different cells, they actually have the ability to send signals that might trigger the reaction in the cells that are locally working.
They're either directing the traffic,
okay,
or becoming part of the tissue, being incorporated.
Okay.
Because we think that since they're pluripotent, that means that they can go from one cell type to another cell type potentially, or fill some of a supportive cellular level role.
So we put these tissues in, and they either have the signals and the tools that the other cells need to do the job,
exactly,
or they're just going to do the job for them and jump right in and become part of that tissue that.
Yeah, certainly, and some of them could be calling in a blood supply. We need more blood here. Some of them can say, hey, we've got a lot of inflammation in the area, and that's actually that's detrimental. Because inflammation is required for healing, but too much of it could destroy normal tissue or potentially slow the process. And we also know that the other side of the regenerative medicine deal is if we can get more comfortable, we can start to use the leg better. And if we use it and load it correctly and walk more correctly, hey, quality of life is improved, and we're probably stimulating healing in that regards.
Awesome.
Rehabilitation.
Awesome. Folks, Dr. Jim Lillich here at the College of Veterinary Medicine. When we come back, we're going to talk about some things we don't know about regenerative medicine.
No matter where, no matter why, the Veterinary Health Center at Kansas State University is committed to providing quality patient care to animals and exceptional customer service to their owners. From routine checkups to emergency and specialty care, our world-renowned specialists and experienced professionals are here to discover, to teach, and to heal.
Let us know.
How can I help?
How can we help?
Next time you see a beautiful field of corn, reach out and thank the farmers who work tirelessly to raise corn for livestock feed, renewable fuels, and exports to feed a growing world population. The farmers on the Kansas Corn Commission work for Kansas Corn with grower-funded checkoff dollars that support foreign and domestic market development, research, promotion, and education to expand opportunities for Kansas farmers. To learn more, visit kscorn.com. Broadband has become as important to us as highways. That is why DocTalk is teaming up with NTCA, the Rural Broadband Association, and rural broadband companies like Blue Valley Telecommunications in fighting for quality broadband access through the program Smart Rural Communities.
I don't think we have any idea what's coming in the future. I couldn't have imagined 5 years ago what we're doing today. So in 2 years, I would guess there's things we can't imagine that we're going to be doing.
To learn more, visit ntca.org/smart or bluevalley.net.
Ag Promo Source is a unique group of marketing specialists with one mission: help your ag business grow. Each affiliate has their own area of expertise, and they work together to bring you advice, products, and services. To get started, visit agpromosource.com. Ag Promo Source. Together we grow.
Soil is the life of a farm, and for 25 years, SureCrop Liquid Crop Nutrition has helped growers produce abundant quality crops while preserving and improving the soils they steward. SureCrop offers complete soil and plant analysis with cropping recommendations, delivery direct to your on-farm storage, and quality crop nutrition custom blended for your field. Choose SureCrop for the assurance of excellence for your soil. Call today or visit their website for more information.
Buying a car shouldn't be this hard. And at Brown Chevrolet Buick in Wamego, it isn't. It's actually awesome. Whether you want a new or used car or truck, Toby's team can make the deal. Even if you want to custom order a new car or truck, Toby's team can make the deal. See Toby's team at Brown Chevrolet Buick in Wamego. We're awesome. Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
DocTalk, brought to you by the Kansas Soybean Commission. The Soybean Checkoff, progress powered by Kansas farmers.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with Dr. Jim Lillich, who's an associate professor in the Department of Anatomy and Physiology here at Kansas State University's College of Veterinary Medicine. And we're talking about regenerative medicine, where Dr. Lillich is an equine surgeon, understands joints, tendons, ligaments, different things that loading the leg and moving and being athletic. And you know, while we know some things that regenerative medicine can do, what are some questions we still have?
Well, I think these are solid, legitimate questions. How do you know that the cell that you're taking from the fat has now become part of the joint? You know, and that's a difficult question to answer, right? So how do we know we're going to be able to, you know, because some get better and some get a lot better and some just stay the same. Nothing certainly is thought that we've made them worse. So we want to know what the molecule is. We want to know all the way down to what is that cell doing and making, because potentially we can recreate that in the laboratory and put that stuff on the shelf, right? So it doesn't necessarily have to, you know, if it's a generic type protein that's not something the body's going to react to, you know, create an immunologic response to it, because that's how vaccines in part work, right? But if we can put that on the shelf, then we don't have to wait for gathering or doing a surgical procedure to harvest the cells, we can use some sort of manufactured process to stimulate the healing. So if we know that, then we can get just a little bit better still.
Yeah, so basically, like when we're talking about they're either providing the tools or they're incorporating in the tissue,
right?
We're going to go just get the tools, harvest those from that tissue,
right?
And then you could use it, in animal or people
or people, right?
Yeah.
And then we wouldn't have to use other medications. We wouldn't have to use a steroid. We wouldn't have to use, because there are toxicities associated with the drugs that make us feel better, right? Even from non-steroidal anti-inflammatories to steroids to, let's be honest, opioids, all right? I mean, yes, they're going to improve quality of life. Yes, you're alleviating pain, but there's still a price that you pay for taking those medications. If we can use something natural, then we really don't necessarily pay the price. So we don't know the exact cellular mechanisms. We don't know what a stem cell might need. We're getting much better at it, but outside the body, to do and direct it to where it needs to go. Hey, we would like you to go into this bony area. We'd like to go into the joint. We'd like you to help us repair that, and or in the tendon, or in the lung, or in, heck, we could open up the door to the bovine mammary gland, the bovine uterus, things that we can need to beat infections with.
I was thinking of
the bovine lung.
Respiratory
right?
disease would be huge
and,
if we could.
And get away from the use of heavy antibiotics or something along that lines. Certainly better for animal safety, for food safety, better quality of life, doing a better job of managing our resources, being stewards of our animals.
Well, the big thing is just saving the lives.
Exactly.
Having a positive outcome, and when we are struggling with coming up with some of the answers, I think there's some incredible opportunities.
I think I think we need to begin to ask those questions, right? Can this be useful? Can this be something that we use and we take it for, with cattle, right? Can we take it from the cow itself or from the steer itself and ramp it up and give it back? Or can we make the molecule and put it on the shelf, and then they can be dosed or treated in a safe fashion?
Perfect. Folks, stay with us. We'll come back with our last segment on regenerative medicine with Dr. Jim Lillich.
This week's That's My Breed brought to you by Gene Trust. Visit us at genetrustbrangus.com.
The adaptability of Brangus cattle are bar none as good as I've seen anywhere. You put them in an environment, it can be a low input environment, a high input environment, these cattle will excel. But the Brangus breed has a strength, in my opinion, in the commercial industry. We have marbling ability from Angus heritage that allows us to get that average choice and higher. And the number of commercial cattlemen that are sitting there buying these Brangus bulls and knowing that they're going home and producing commercial influence Brangus heifers that I know are going to excel in udder quality and fertility, longevity, and can produce a heavy weaning weight calf. It's just incredible to see commercial cattlemen utilize our cattle. Now's a good time to be invested in the cattle industry. And if you're going to do that, why don't you invest in the right genetics? Brangus genetics that you know will do it economically, they'll do it with limited inputs, and give you maximum outputs. That's where the profitability is.
Nestled in the heart of the Flint Hills lies one of the most proven and productive seed stock herds in the country. Based on fertility, longevity, and soundness, these cattle combine impeccable maternal strength with a performance and carcass foundation built to meet the highest standards. Vernon and Vicky Soon and the Gene Trust partners invite you to join them on March 22nd at Soon Cattle Company for their 23rd annual event, offering up 170 Brangus and Ultra Black bulls backed by complete performance information and genomically enhanced EPDs. For more information, visit genetrustbrangus.com.
Hello, I'm Dr. Frank Lyons from Kansas Regenerative Medicine Center here in Manhattan, Kansas. Daryl was one of our patients that we did about 7 months ago.
I dug trees by hand for years and years and years. In the process, I wore out my rotator cuff. But when I learned about this process, I thought if there's a way to get rid of this pain, then I want to do it. So we did it, and it worked. And I'm not going to go out and dig trees with a shovel anymore, but I can do the things that I want to do now.
Well, it's been very gratifying to help people with their painful joints and other entities, and it's been especially gratifying to be able to help people who I know and have worked with and known for many years.
Grain sorghum is one of the most important cereal crops worldwide, and Kansas leads the nation in its production. A high-energy, drought-tolerant crop, sorghum only requires 6 inches of water to produce the first bushel. And with its wide uses and easy adaptation, sorghum proves to be a truly indispensable crop. Kansas Grain Sorghum is committed to sorghum research, market development, and education. Learn more at ksgrainsorghum.org.
Kansas Farm Bureau, the voice of agriculture, represents grassroots agriculture. The state's largest and most powerful farm organization stands up for its members through leadership development, agriculture education, legal defense, environmental advocacy, farm safety, and risk management. Members also enjoy money-saving benefits. To join our organization today or to learn more, go to www.kfb.org or find us on Facebook and Twitter.
Healthy cows start with the new hired hand automatic livestock sprayer. Rancher invented to provide an efficient alternative to pour-on and injectable parasite management systems. The portable design allows cattle to treat themselves head to hoof. Strategic device placement with pass-through activation technology takes the stress out of parasite treatment for cattle and the rancher. Get the new hired hand for yourself or become a distributor. Visit cowsprayer.com. The new hired hand makes healthy cows easy.
Kansas Farm Bureau, the voice of agriculture. To join today or for more information, go to kfb.org or find us on Facebook and Twitter.
Hey folks, welcome back to DocTalk. We're talking about regenerative medicine. It's something that is cutting edge, that's the future. It's here and it's the future. And this is Dr. Jim Lillich, who knows quite a bit about it. He's an associate professor in anatomy and physiology here at the College of Veterinary Medicine at Kansas State University. He's an equine surgeon, world-renowned equine surgeon. We're lucky to have him on our faculty. We're lucky to have him here on the show. But so what are we going to do?
That's a good question for veterinary medicine. Certainly, they've poured a lot of money into regenerative medicine and on the human side of things. You know, Harvard's got a $2 billion facility, so that's billion. And where we're headed on the animal side of things, and I think we need to open the door more for the small animal side of things, because we know a whole lot more about what the horses are doing with that and whether that is helpful for the equine athlete. But for the companion animal, you know, the animal that's ridden on the weekends for fun or lives in the house with us, you know, the dog especially, I think we're going to begin to use their conditions and prospectively treat them. Can we harvest certain cells? Can we help those dysplastic dogs? And if we can find a way to make them feel better, they're in turn going to give us the information that's potentially going to help us. Certainly our lifespans are much longer than theirs, but you know, an aged dog at 15 is like the 75-year-old person potentially, or 85, and there's a big need to know that in human medicine, and certainly our pets are actually going to provide that for us, that information for us, those clinical trials that mean something.
Yep, and then there's some things that we can do with comparative medicine in this, so we can learn on animals and apply it to humans.
And hopefully if we can use what we know about the human stuff in the petri dish, or in the laboratory or where we grow the cells, and we can use that information back to help our companion animals as well.
Right.
You know?
Well,
so we have to ask those questions. Hopefully we get the funded research to get the questions in the molecular avenues that we see, that we need to know about, and then take us to the next step, you know, and that is more clinical trials, more directed therapy, refine it to the point where it's a known entity in what we're doing, you know all the mechanisms that are involved.
That's awesome.
Yeah.
Well, folks, regenerative medicine is something that is here. It's something that's going to change the future of both human and animal health. We have researchers like Dr. Jim Lillich here at Kansas State University that's working on it on a day-to-day basis, him and Mark Weiss, tremendous research potential. We appreciate you watching DocTalk. Remember, always work with your local veterinarian, and if you want to know more about what we do here on the show, you can find us at www.doctalktv.com. Thanks for watching DocTalk today, folks. I'm Dr. Dan Thomson at Kansas State University, and I'll see you down the road.
Closed captioning brought to you by Ag Promo Source. Together we grow. Learn more at agpromosource.com.